What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering how different ethnicities of patients are seen more common in the emergency room for certain stuff compared to others. So to give you context, I'm an Xray tech. I've been doing it for 4 years. I work a lot of overtime, so I do dabble in day shift. So just to put this out there, I'm not racist. I think the concept of that is to me mind-boggling because I can't. Like, I'm here to help, especially us who work in the healthcare. Like, you can't be, because you're helping everyone. Everyone deserves health. Everyone deserves care. Everyone deserves to be treated the same, you know? Like, no. But the sad reality is, even in our time of 2024, it does exist. I've experienced it all the time while out there in non-hospital, in the hospital. Like, it exists, sadly. It do. But what I have noticed is certain ethnicities come in more for certain problems, and that's what we're dealing with. Not to do with racism or anything, but just, I don't know if it's just a trend or that's kind of what you're dealt with, and that's something to expect, or maybe that's financially, or I don't know. I'm just putting out what I see and just educating you if you're curious. So let's say fall on thinners, ground level fall. You know, the typical I've fallen and I can't get up, life alert situation. I'm gonna keep it real with you. Majority of the time, I would say 70% of the time it's old white ladies. Almost 70% of the time it's old white ladies. I don't know. That's literally when they say it's a fall in thinners and I go in there to do my hip X-ray. 70% of the time it's gonna be an old white lady. Usually anyone 70 and above will, majority of the time. Sometimes they'll have a little bit younger, or sometimes we'll have them even older. But majority of the time, 70 white old lady will be the one. And you'll either have a prosthesis that popped out, or your hip was fine and it broke, or sometimes your butt just got a bruise on it. Like, it could be the different severities, right? Or your coccyx broke or whatever is going on. Okay. Followed by the old white lady, you have probably another 10% is the dudes. Older white dudes will come in. And then after that, I would say it would fall on older African American ladies that will come in. And like even Mexican, like Hispanic, I would say I've only done maybe five of my own people in the hospital that's fallen, and for that only 5. That's pretty low in comparison, because like almost every shift I'll have ground, like, people who fall. I'll guarantee, especially night shift, old people, either they get up to go to the bathroom, or grandma who wanted to get her Oreo cookies and fell. Like, I've heard it all. But almost every shift, I can guarantee you there will be between 1 to 3, always. And the peak time, and I'm going to say this so you have the knowledge. So when you get old, the cookies ain't worth it, bro. Don't do it. Don't do it. Peak time is literally in the night. 12 to like 3 a.m. they will fall. When they wake up in the morning, 6 a.m., they'll be in peak times. Us as young folks, take this knowledge when you're old and try to prevent it, because that's what's happened. I have said knowledge with me, and I'm going to make sure that doesn't happen, and I'll be extra careful. I understand there's certain people that come in with dementia, come in with all the other situations they can't help it. Or they have other, like, bone issues, or they have other problems that they can't help it. It'll happen. But I don't know if My people don't come because maybe financially most of our people aren't good, so they feel like it's not worth. Well, they can maybe not even worth it, but like they can afford it, so they don't. Because I know our people, Hispanic people, would rather do home remedies before going. Like you had to be dying before most of our people would go there. They're just speaking about my ethnicity. I can't say about the other ones, but I will say that those are kind of the stat. Just for falls on thinners, that will happen a lot of times. And other health problems, I would say, like a lot of like chest pain, shortness of breath. Once again, like it's another like it's mainly white people that come in, or there's also people with that the pacemakers is another big one. They'll come in with chest pain. That one, yeah, I've seen it all. My people, white, black, like everyone who, if you old and you have heart problem, like it don't matter. Like that's what I've seen. Other people, maybe because they have medic. Some people will come in a lot. Like I recognize their face, I recognize their name. Some people, and they'll come in a lot. I feel like other people will come in for anything just to be safe. And if they got like Medicaid or something that the government gonna pay, they're like, why not? Why not just be safe? So I'm like, you know what? I mean, I ain't gonna dog you. Like it's majority of the times when they're freaking flyers, either they have like a known thing that they can't help it, that they're bad. Other ones they come in just because maybe they feel a little thing, just to be safe, Well, why not, And like the chest X-ray will be remarkable, clear, whatever, fine, and they'll leave. So like I don't know, it's kind of it'll vary. And I mean, I would say the other one, not really ethnicity, but babies, don't matter. Don't matter white, black, Mexican, Hispanic, whatever. Babies they're a different level. They're up here. Because as parents, I am one, you're always scared for your kids' health. Especially if they're tiny, can't talk, and you see something, you want to do something. So like that one, doesn't matter what race, ethnicity, whatever. The babies will be babying. They're in their own little universe up here, as far as the issues, because like you don't know though, like especially if they can't talk. I would say anyone like 1.5 and under, they're kind of fall in a special little section of cuteness. That because we're afraid, especially me being a parent now, seeing especially if you're brand new kid, like new to the world, and like your parents like new like first time having a kid. You can get all the knowledge, you can get all the stuff, but like at some point when you're out there, you're just like this is not the same. He not different. He look different. He acted different. He not breathing. He not eating. Like there's stuff, and then like you get kind of paranoid, and sometimes you'll show up to our hospital. We'll do a basic chest X-ray. Nothing's wrong with him. Maybe he has the sniffles. Maybe he has stuff, but you would always rather to be safe. So they're in their own little cuteness section of stuff. And yeah, it's been your boy Miguel. See you on the next one.